I'm going to be presenting. Adam Kramer, my team lead in the CDC's COVID-19 response, will be calling in. Okay, so in this presentation, I'm going to cover considerations for public aquatic venues here in the U.S. We're going to talk about promoting behaviors that prevent the spread of COVID-19, maintaining healthy environments, maintaining healthy operations, and preparing for when someone gets sick. And then I'll close off with, or I'll end up with CDC COVID-19 resources. As far as the considerations document, please realize in the U.S. we are a federal republic. So according to our Constitution, the powers around health fall within the states. So this presentation is going to talk about the safety considerations for the safety of those who operate, manage, and use public pools, hot tubs, and water playgrounds. But really, these are just considerations. All decisions about implementing these considerations should be made locally in collaborations with local health officials. So when I'm talking about behaviors that prevent the spread of COVID-19, CDC talks about educating staff, patrons, and swimmers about when to stay home if they have symptoms of COVID-19, if they test positive for COVID-19 or are waiting for test results, and if they were exposed to someone with COVID-19 in the last 14 days. As far as cloth face coverings and hand hygiene, we are encouraging the use of cloth face coverings, but advise that they not be worn in the water. When they become wet, they're difficult to breathe through. And we also ask our state and local partners to consider encouraging staff, patrons, and swimmers to wash their hands often and to cover their coughs and sneezes. And that means our operators across the U.S. should be thinking about making sure they have adequate supplies, whether it be soap, paper towels, tissues, non-touch trash cans, preferably with a cover, as well as making sure there's hand sanitizer. We like hand washing much better than hand sanitizer, but hand sanitizer is an option as well. In terms of getting messages out, about staying home, about wearing the mask, about social distancing, we ask our state and local partners to consider having signs posted in highly visible locations. The sign is not going to make a difference if we're going to be posting the sign behind a pole. So it should be at the entrance door, for example, before you go on the pool deck. It should be right on that door, right by that window. And to remind everyone about how to stop the spread of COVID-19, because this is really each of us taking our actions, each of us doing our part, proper hand washing, everyday protective measures, including, wearing the cloth face covering. CDC has print resources that I will link to at the end of the presentation, as well as we're asking the public to broadcast regular announcements on their PA systems. We have a suite of recorded messages for the public, for our staff, for our patrons. We also talk about including messages about COVID-19 in contracts with individuals or households, in emails, in facility websites. Take the videos that CDC has created and post them on your website, for example. Take what we've created in our social media bank and use that on your social media platforms for your accounts. And on entrance ticket, any way you can to get these messages out. In terms of healthy environments, it's about making sure we stay at least 6 feet apart, whether we're in the water or on land, from those we don't live with. This has been an issue here in the U.S. where CDC came out and said we're not aware of the virus spreading through the water we swim in. I think a lot of the public interpreted that to mean they're safer in pools, or maybe the aquatic sector portrayed it as people are safer in pools as opposed to on land. So that's something we have stressed, that you're going to social distance on the deck as well as in the water. We talked about in our considerations physical barriers and guides, physical cues such as chairs and tables to keep people 6 feet apart or about 2 meters apart or more, using lane lines in the water, putting up signs, using tape on the decks, the floors, the sidewalks. The way we've talked about it with pool operators here is once you take the water out of the pool, It's like any other public setting, the grocery store or whatever it might be. So what we are learning from other settings that people are frequently in, we can apply to the pool oftentimes. In terms of communal spaces and shared objects, we've talked about staggering the use of communal spaces. For example, in the water, in the break room. We see pools around here down south where we've been swimming since late May. Having a schedule, setting up, well, and this hour my family's going to the pool on Monday. I know my local gym also has a similar schedule that you can sign up for a lane to do lap swims every hour. It's also about keeping the break room pretty open. And to help with that, also in the parking lot, staggering when people are coming in and out. So if there is a bigger gathering or if there is time for something to happen that people are coming to, well then, okay, people with the last name A through F come at this time. And then G through M come at this time. We are talking about cleaning and disinfecting frequently touched surfaces. So people from different households are touching the handrails in the pool, the door handles in the bathroom. Those surfaces are going to have to be cleaned at least once daily. And we say increase the frequency depending upon the frequency of use. We are trying to discourage people from sharing items that are difficult to clean, sanitize, or disinfect, or that are meant to come in contact with the face, kind of goggles, snorkels, nose clips. And we are discouraging the sharing of items such as food, equipment, toys, and supplies. For cleaning and disinfecting, we've talked about frequently touched surfaces at least daily and shared objects between users. And I kind of touched on this before. In the water, we're talking about handrails and climbing structures and slides. On the deck, we're talking about lounge chairs, tabletops, shared objects. We're talking about pool noodles and kickboards. In terms of door handles and surfaces in restrooms, hand washing stations, diaper changing stations, showers, whatever's frequently touched. In the U.S., we have a list of over 400 disinfectants that the U.S. Environmental Protection Agency has approved for disinfecting surfaces against SARS-CoV-2, the virus that causes COVID-19. And we have asked our pool operators to be in touch with with whoever designed their venue when we're talking about surfaces, or with the manufacturers who created the kickboards or the pool noodles that are being cleaned. We want to make sure, since we have such a list of disinfectants, we want to make sure we're using the best one for the surfaces and equipment and creating the least amount of damage to the surfaces and equipment possible. In the U.S., we have found that there have been issues with injuries related to improper use of disinfectants. So we're encouraging the public, our pool operators, and the public at home when disinfecting to follow the directions on the label. And of course, as always, included in those directions is securing the chemicals away from children. In terms of maintaining healthy operations, it's about protecting vulnerable staff. We have asked vulnerable people who have the option, such as our patrons, to not come in to public pools until their local authorities, health authorities, say it's okay. But vulnerable staff doesn't have that option. People need to make money and pay their rent or whatever the case may be. So if people have underlying conditions, if they are 65 years or older, giving them the option to telework or take on other job responsibilities that don't involve as much contact with others. With lifeguards, we want to make sure that our lifeguards that are on active lifeguarding duty, that are going to jump in and potentially rescue a distressed swimmer if needed, that they are not the ones monitoring the hand washing of others, the others using cloth face coverings or social distancing. They should be focused just on lifeguarding. In terms of sick leave policies, we are asking owners of our public pools to be flexible and non-punitive. We want sick people staying home. We don't want them coming in and getting the whole staff sick, and patrons as well. We want to train our staff on all safety protocols, and if it's feasible, pools might want to consider conducting daily health checks, so temperature screening and symptom checking. But please keep in mind that there are asymptomatic people, and there are people who don't yet have symptoms. They've just become infected and haven't become symptomatic yet. So these health checks are not going to capture these people. In terms of gatherings, where you go in the US is going to determine how large a gathering is. We ask our operators to avoid events, gatherings, meetings, events, whatever the case may be, in and out of the water if social distancing of at least 6 feet between people who don't live together cannot be maintained. The only time we're saying that we shouldn't be social distancing if someone needs to jump into the water to rescue a distressed swimmer, provide first aid, or perform CPR. And also individuals in the process of evacuating the aquatic venue if there's a thunderstorm coming in, if there's a fecal incident in the water, a distressed swimmer in the water, and the water needs to be evacuated. We're not as worried about social distancing. The priority is to get out of the water. Or if there's something wrong with the facility, a fire, for example, it's an emergency, social distancing is not the priority. It's getting everyone to safety. And then, it's making sure that operators are following their state and local regulatory agencies' policies on gathering requirements. But again, if there is a gathering, this is a good example of a good time to kind of stagger when people are coming in. If 100 people are getting together or 50 people are getting together, they shouldn't all arrive in the lobby at 1 o'clock. The other thing we try to address is, what if someone gets sick while at the aquatic venue? So in that case, we want to isolate and transport those who are sick to their home or a healthcare provider. And you want to immediately separate the sick person, whether it be staff, patron, or swimmer, from others. And you want to notify local health officials and close contacts if possible. Here with, if someone's getting sick, we're going to have to clean and disinfect where the sick person was. We want to close the area or areas off, and we don't want to reopen them until they're clean and disinfected. We are asking for the operator to wait at least 24 hours before cleaning and disinfecting areas. This is for multiple reasons, allowing droplets to settle and the virus to start degenerating a little bit. We haven't gotten too much pushback from the aquatics venue, but in some venues, this might not be possible. So we try to get as close to 24 hours as you can. Ensure safe and correct use of disinfectants, as I mentioned earlier, following the directions on the labels, securing chemicals away from children. And all this is a list of links that we have pulled together with our latest COVID information, cleaning and disinfection guidance for healthy swimming. On last Thursday, we put out beach guidance as well, so I can work on adding that to the slide and sending that back to the group. But that's kind of what we've been looking at here in the US. And that's it for me.